Hello. So first of all, a massive thank you to all the amazing aged care nurses who responded to my plea for help and assistance. Aged care is not an area that I've personally nursed in, but thanks to them, I've been able to put this together to help with some of your questions about job hunting and what to expect as a grad starting off in aged care. The very first question to ask yourself is, why are you job hunting in aged care? It's really important that you understand aged care nursing isn't something you do just because you can't get another job and you're just filling in time. It's not a job that's inferior or less skilled than other forms of nursing. From talking to aged care nurses, it's very, very clear that you need as much critical thinking, time management, and problem-solving skills in aged care as in hospital-based nursing. I would also say, talking to them, that they have been required to show far greater set of leadership skills within aged care than what I personally have been required to do working within the acute hospital system. You also really need to care about the geriatric population and be passionate about their health and well-being. While aged care may not be where you plan to nurse forever, you need to be prepared to give the residents you work with your absolute best nursing skills. Whatever your long-term career goals are, the reality is that the Australian population is aging at a rapid rate, and the geriatric population make up the majority of hospital admissions. So this is a population that you will be working with. You need to value this population and value your health. So when you're applying, think about what values are you going to bring to these residents. Do you care about them? Do you care about their health? Because if you don't, then this is not the area for you. When it comes to your resume or applications, essentially on paper, you guys all look the same. You have the same registration and the same lack of experience. It's really important that you make sure you check spelling and grammar very, very carefully, because if a recruiter has multiple applications and they all have the same level of education and experience, spelling mistakes and grammatical errors can be enough to get your application discarded. Include things that might make you stand out, things that you're passionate about, interested in, hobbies, whatever it is. A facility manager I spoke to decided to interview a candidate based purely on the fact that they had included bread making on their CV. It was just something that sparked an interest and made her think, yeah, I'll bring this person in for an interview. Another thing that is super, super important to include on your CV or resume at this point in your career is any CPD or additional learning that you've done. This shows that even whilst you may not have been working in the area, you have an interest in continuing to learn and engage. I'll include some links below for some education resources, but topics that are especially useful for aged care include palliative care, medication safety, wounds, diabetes, and dementia. The Council runs some great free workshops on palliative care, and things like completing the MPS Medwise medication safety course, which is also free. It's a great thing to put on your resume. Some important topics that you should educate yourself on and understand before applying to work in aged care is, what is the aged care funding instrument? This is a really important thing to understand because it does have an impact on aged care and the services that you provide and the residents that you have underneath your care. Another really important thing to understand is what the aged care standards are and how they're audited, and all of this information is available online. It will also be really useful going into interviewing and applying to work in this area to understand what are mandatory reporting things within aged care, and these include things such as abuse or assault, missing persons, and reportable illnesses such as gastric illnesses and influenza or COVID-19. A final thing to consider is to make sure you'll be safe. I'll cover this a little bit more later, but nursing in aged care is a lot more autonomous than nursing in a hospital. You don't have the presence of multiple other nurses, coordinators, medical staff, and so on. A smaller facility, and by that I generally mean one that's got less than 50 residents, possibly, and in fact probably, only has one RN on in a shift, which in this scenario would be you. For this reason, many smaller facilities will not hire graduates because it's not safe for you and it's not safe for residents. That doesn't mean you shouldn't apply for aged care, but apply for larger facilities because they're happy to hire and support graduates as they have more than one RN on in a shift, and they're able to safely support you in your learning in that role, as well as ensuring their residents' safety. So, what is a typical day in aged care as a nurse? Well, there isn't really a typical day. It's more like there's typical tasks that need to be achieved, plus you're also dealing with the unexpected and remembering that within aged care, you're working in these people's home. You need to work around when they have visitors, when they have activities on. It's different to being in a hospital. You need to be able to work on prioritizing your tasks and managing your time, because you can have care for 10 to 40 residents. Will all be under your care. We'll all have tasks that need to be done, and you need to be able to prioritize that. In terms of time management, most of the aged care nurses I spoke to don't use a time planner as such because of the number of residents they're working with, in addition to the dynamic nature of the work. However, they do have a systemic approach to their day and their workload. A very, very basic day breakdown can be broken into starting off with things like your medications. So, what medications need to be given, and whether you need to give those individually or whether you're delegating that to a medication competent carer, and who needs any insulin. After the medication round is done, then doing any wound care or procedures such as IDCs, stitch removals, staple removals. Then after that, then working on documentation, any admission that needs going through, checking progress notes for tasks that need completing. In addition to this, throughout the day, you will need to deal with unexpected things like falls, unwell residents, or families. One of the nurses that I spoke to would have a notebook in which she would write all the tasks for the day, but would colour code them. So she would use one colour for, say, procedures. She might use another colour for medications. She used red for urgent tasks that needed to be done throughout the day, and that kind of helped her to keep track. So you are going to have to work out what system works for you. The other thing is that leadership is a much bigger part of working as an RN in aged care, from my experience, compared to working as a graduate nurse in a hospital setting. You'll be working with a team of carers and ENs, and you will need to delegate and allocate tasks as appropriate to that worker scope of practice. This means you'll need to get to know your team, what their capabilities are. You may also be involved in education and training new team members or student nurses, or even older team members who want to learn new skills. Your communication skills are going to be a vital part of this, as you need to be able to delegate tasks clearly and ensure that tasks are completed whilst also not micromanaging your team members, because nobody likes that and it's not an efficient use of time. So, what do you need to know if you're going to work in aged care? And sometimes I get questions wanting to know about specific medications to learn, but it's not really important to memorize a list of medications, their side effects, their dosages, all of that. You will have the resources to look this information up if you need to. What is important is learning about your residents, the medications they take, why they take them, the pathophysiology involved. You're going to grow in this area in terms of knowing medications, and hirers don't expect you to know all of this off the top of your head when you start, but it's about getting to know why they're taking these medications. Why does this resident need this? Sorry. And a good rule of thumb to remember is that your resident with the most medications is most likely also your most unwell resident. So this isn't going to be your complete guide to every drug, procedure, illness you're ever going to see in aged care, but I'm just going to give some pointers of things you might like to start learning about if you're interested in working in this area, and the kind of things you should be learning about your residents when you start out. It's important once you start working that you get to know which of your residents are on anticoagulants and why they're on that anticoagulant. And it's important to know which anticoagulant they're on. For example, warfarin versus novel oral anticoagulants, which you'll often just hear called NOACs. For example, warfarin needs to be carefully titrated. So there'll be blood tests that need to go along with taking warfarin, and that's at different ratios or timings, depending on whether that person's newly started that medication or been on it for a long time. But warfarin is also quickly and easily reversed. On the other hand, your NOACs don't require as close monitoring and blood levels, but some of those anticoagulant agents have no reversal agents available in Australia. So when your patient is on anticoagulant, it's really important to understand the implications for your patients if they fall. Because remember, anticoagulants are blood thinners. These people, we're trying to make them bleed more easily. And you should always refer to your facility policies of wherever you're working, because they will often have a policy around what to do if someone falls. Also think about what are some of the complications of this anticoagulation. For example, if their doses aren't high enough, they could develop clots, but if their doses are too high, they can experience things like bruising, GI bleeding, and anemia. It's also important that you get to know which of your medications are time sensitive and which have to be given with or without food. A really important one is any residents who are on medications for Parkinson's medications. These patients are on specific and carefully timed regimes, and medications being late even by a small window, such as 10 minutes, can have a significant impact on their symptoms, such as tremor, muscle stiffness, freezing, and this can result in an increased risk of complication and harm to that resident. Thyroxine is also sensitive to time and should be given on an empty stomach. So many elderly residents will have medications for cardiac issues. There are a lot of cardiac medications, and I'm not going to go through all of them by any means. But three major classes of cardiac medications are your beta blockers, your ACE inhibitors, and your calcium antagonists, or they can also be called your calcium channel blockers. So rather than learning each drug individually, understand how each class of drug works. Many residents with cardiac history will be on a diuretic, and a really common one that you'll see is furosemide. A lot of people refer to it as Lasix. Lasix is a brand name. I tend to prefer to refer to things by their generic names. So furosemide is a loop diuretic. It's not potassium sparing. So you need to be aware that any of your residents who are on furosemide are at a higher risk of hypokalemia, and what kind of signs you would see in someone who has hypokalemia and when you should seek medical attention for them. It's also important to be aware of whether or not your resident is on a fluid restriction, because quite often someone who has a cardiac history will be fluid restricted. And if they are in a fluid restriction, is their intake being documented accurately? Diabetes is an ever-prevalent disease within our society, both type 2 diabetes, which can be impacted by lifestyle choices, but also type 1 diabetes, which is also on the rise and is unaffected by lifestyle changes such as diet and exercise. So make sure that you know in your head a basic difference between type 1 and type 2 diabetes, and know which form your resident has as well. Is this resident on an oral medication for their diabetes? Are they diet controlled, or are they on insulin? Is their insulin a quick-acting insulin that needs to be given with meals? Are they on a basal insulin? What frequency of blood sugar monitoring do they require? What are the signs of hypo or hyperglycemia, such as confusion, irritability, garbled speech, weakness? How do you manage your resident? Or what should you do when someone is experiencing a hypo or hyper? And again, your facility should have policies, and so know what you need to do in that situation, because remembering you're the RN in this situation. You don't necessarily have a doctor there available immediately to answer questions or inquiries, so you need to know what you can do in that situation in order to look after your resident. Just a couple other quick things is pain relief. Really commonly given both as a regular and as an as-required medication within aged care. So things like your paracetamol, your anti-inflammatories, if anyone's on an opioid, pain relief, what kind of checking process there is for that, when they need that, what your timings are for that. But also you may be involved in giving palliative medications, and these are medications that focus around symptom relief and comfort. And so also having a grasp of what your basic palliative medications are. Many elderly residents will also have gastric issues. It's quite common part of aging that the gastric tract slows down. So be familiar with which of your residents are on regular aperients. Learn your facility policies on what to do if a resident is constipated, when you should seek medical assistance for that. And just a final class of drugs to familiarize yourself with is probably your proton pump inhibitors. And a really common one for that is pantoprazole. So I hope this has been helpful for you, both in your job hunting, but also just some stuff to learn or some guidance for when you're starting out working as a graduate nurse within the aged care industry. All the best.